You've probably been told that masturbation is a young man's game. But what if the truth after 50 is actually very different? I'm Dr. Laura Stone. Let's start with a simple but powerful truth. If you're still enjoying private intimacy after 60, you are not alone. Large studies have shown that between 41 and 65% of men aged 60 to 75 reported masturbating within the past month. This isn't some rare, fringe behavior. It's common, and for many men, it's an important part of their sexual and emotional well-being. And yet, so many men carry quiet shame about it. This isn't just about physical release. We're talking about confidence, sleep, stress, even, and this is where I want you to pay attention, possible protection for your prostate health. I see too many older men silently wondering if their natural desires mean something is wrong. They worry that their interest in self-pleasure is a sign of immaturity, weakness, or even a health problem. In reality, the medical consensus has been clear for decades. Masturbation is a normal, healthy sexual behavior at any age, as long as it's not interfering with your daily life or relationships. That's it. No moral judgment. No arbitrary age cutoff. Just a factual, clinical statement. Now, you might be wondering, if it's so normal, why do we need to talk about it? The answer is simple: because myths thrive in silence. And when myths thrive, they can quietly erode a man's confidence, relationships, and even his willingness to care for his health. One of the most stubborn myths? That self-pleasure later in life is a sign of loneliness or desperation. That's simply false. Many men with loving partners still engage in solo intimacy, just as many women do. It's a natural form of sexual expression, and it can exist alongside, not instead of, shared intimacy. Here's another myth: that it's somehow physically harmful to your prostate, your testosterone, or your sexual performance. The best available evidence actually points in the opposite direction, that a healthy frequency of ejaculation might have benefits for your prostate health over time. Before we can talk about frequency or health benefits, we need to understand what's really happening in your body during self-pleasure and why the medical community considers it completely normal at any age. For centuries, cultural and religious beliefs painted masturbation as dangerous or immoral. In the 18th and 19th centuries, you could even find so-called medical pamphlets warning that it would cause blindness, weakness, or insanity. These claims weren't based on science. They were moral arguments dressed up as medicine. Fast forward to today, and the science is clear. Masturbation is simply a natural sexual behavior. So, what's actually happening when you reach orgasm? In simple terms, your brain sends a cascade of signals through your nervous system. Blood flow increases to the pelvic area, muscles in the pelvic floor contract rhythmically, and a wave of neurotransmitters, chemical messengers, floods your brain. Two of the most notable are oxytocin and prolactin. Oxytocin is often called the bonding hormone, but it also promotes feelings of relaxation and satisfaction. Prolactin helps create that sleepy, satisfied feeling afterward, which is one reason many men notice they can drift off more easily after intimacy. Endorphins, the body's natural painkillers, also play a role, improving mood and reducing stress. Physiologically, this process is no different at 65 than it is at 35. The main difference? As men age, erections may take longer to achieve and orgasms can feel less intense. This is largely due to changes in blood vessels, nerve sensitivity, and hormone levels, not because the act itself is harmful. Another important point: there's no credible evidence that masturbation drains testosterone levels in any harmful way. While there may be temporary shifts in hormone levels right after orgasm, they return to baseline very quickly. In fact, regular sexual activity of any kind can help maintain healthy erectile function by promoting good blood flow and keeping pelvic floor muscles active. Now, let's address a few of the myths head-on. Myth 1. Too much will cause erectile dysfunction. There's no medical proof that masturbation alone causes ED. What can cause ED are cardiovascular disease, diabetes, certain medications, and other health issues that affect blood flow and nerve function. Myth 2. It means you're not satisfied with your partner. Many men in fulfilling relationships still enjoy solo intimacy. It can be a form of self-care, stress relief, or simply part of your sexual routine. In some cases, physical limitations, travel, or mismatched schedules make it a practical option. Myth 3. It's immature or should stop after a certain age. The idea that sexual expression has an expiration date is one of the most damaging myths in men's health. In truth, maintaining a sexual connection with yourself and, if applicable, with your partner can be part of healthy aging. Once you strip away the myths, what's left is a simple reality. Masturbation is a safe, normal behavior for most men. One of the most talked about potential benefits involves the prostate. Your prostate gland produces some of the fluid in semen, and over time, it can accumulate inflammatory byproducts. Some researchers believe that regular ejaculation may help flush out the prostate and reduce the risk of cellular changes that could lead to cancer. Now, I want to be crystal clear, this isn't proven prevention, but several large studies have found a meaningful association between higher ejaculation frequency and a lower risk of prostate cancer. And the numbers are compelling. Let's talk about one of the most surprising findings in men's health research over the last 2 decades: the link between ejaculation frequency and prostate cancer risk. In 2016, researchers at Harvard's T.H. Chan School of Public Health followed over 30,000 men for nearly 2 decades. They found that men who ejaculated more often had about a 36% lower risk of being diagnosed with prostate cancer before age 70 compared to those who did so less than twice a week. Other research, including more recent studies, points to a similar trend. Men reporting 21 or more ejaculations per month had around a 31% lower risk than men with lower frequencies. Why might this be? One theory is that regular ejaculation helps clear out potentially harmful substances from the prostate, reducing inflammation. Another is that it promotes healthy turnover of prostate cells, lowering the likelihood of cellular damage over time. And this is where a lot of older men breathe a sigh of relief. What they thought might be a guilty pleasure could actually be a part of their wellness routine. That doesn't mean you need to force a number or hit a target. It simply means there's good reason to see solo intimacy as compatible with long-term health. But prostate health is just one piece of the puzzle. Let's talk about the other benefits that are relevant to men over 60. First, sleep. The release of oxytocin, prolactin, and endorphins after orgasm can help relax the body and mind, making it easier to fall asleep. For men who struggle with occasional insomnia, this can be a natural, medication-free option. Second, stress relief. Sexual release helps lower cortisol, the body's primary stress hormone. Lower cortisol levels are linked with better mood, improved immune function, and healthier blood pressure. Third, pelvic health. The muscle contractions during orgasm engage the pelvic floor, the same muscles targeted in Kegel exercises. Strong pelvic floor muscles can support bladder control and erectile function. Now, let's talk about how to practice safely and comfortably as you age. While the fundamentals are the same, older men sometimes need to make small adjustments. 1. Listen to your body's cues. If you feel soreness, notice a drop in sensitivity, or find that your erections take much longer to recover, give yourself rest days. 2. Use lubrication if needed. Skin can become thinner and more sensitive with age, so using a water-based or silicone-based lubricant can reduce friction and protect skin. 3. Be mindful of technique. Overly aggressive or overly tight stimulation can lead to what's sometimes called death grip, where your body gets used to a specific sensation that's difficult to replicate with a partner. If you notice delayed ejaculation or trouble climaxing during shared intimacy, it may be worth easing off the intensity. 4. Hydrate and manage overall health. Sexual health doesn't exist in isolation. Cardiovascular health, nerve health, and hormone balance all affect sexual function. Staying active, eating well, and managing chronic conditions are all part of the picture. One more thing, if you ever notice persistent pain, blood in your semen, or sudden changes in your sexual function, check in with your doctor. While these symptoms are usually linked to treatable issues, they should never be ignored. Here's where most men get tripped up. They hear a statistic like 21 times a month and assume there's a universal goal. That's not how sexual health works. There's no single right frequency for everyone. And always remember, All information provided in this video and channel is for educational and informational purposes only. Always consult a medical professional about your specific circumstances and before making any changes to your lifestyle, diet, supplements, or medication.